Hi everyone, welcome to our pre-health information session. My name is Raksha and I'm one of your pre-professions peer advisor here at the ACE Center. And I'm really excited today to talk to you guys about what it truly means to be pre-health and how to navigate through this path. Whether you're here because you're curious about healthcare and don't really have plans yet, or you already have a plan and just want to learn more, you're exactly where you're supposed to be. This session is about exploring, not deciding. So feel free to just listen and learn as we move forward. A little bit about myself is that I'm a neuroscience and biochemistry major with a minor in care, health, and society, and I'm also on the pre-med track. So if you have any questions regarding pre-health or pre-med in general, feel free to reach out to me after the session via email or even come in for a drop-in session at the ACE Center. So for today's agenda, we're going to be focusing on what kinds of healthcare careers exist and how to prepare academically and outside the classroom. And then we'll kind of go into the next steps and what they'll look like if you'd like to continue down this path. So here are your peer advisors, Carly, Arpit, and I. And before we jump into everything else, I just want to quickly explain the role of a peer advisor. So we are students as well, and we've been where you are. So our role isn't to tell you what to do or expect you to have everything figured out. It's to help you explore, ask questions, and talk things through, especially if you're undecided or just want to make sure you're on the right track. You don't have to come in with a specific question. It could be as simple as, I'm interested in healthcare, but I don't know where to start. And that's more than enough. So to start off, this is the question that we'd like to ask. What are my options for healthcare professions post-grad? This question can feel a little overwhelming, especially early on. And this slide and the slides moving forward are not to make you choose anything. It's just to show you what's out there, because a lot of students don't know all the careers that exist. So it's more about awareness than commitment. So here at the ACE Center, we support students across all these paths, not just one. Whether you're confident in your direction or still figuring it out, our role is to help you explore and to build toward whatever ends up fitting you best. And we also provide resources and support to make you a competitive applicant. One thing that I would like to emphasize is that there are a lot of ways to work in healthcare. You could be pre-med, pre-pharmacy, pre-PT, and more. And we offer workshops, events, and even one-on-one guidance to help you figure out your way in your journey to pre-health. So this is the pre-health umbrella, and it's probably one of the most important things to understand early on. It's that pre-health is a track, not a major. Any major can work, and you don't need to choose a major before you start pre-health. Exploring majors is actually part of the process. What matters most is the academics, experiences, and getting involved in things that genuinely interest you. And all of these together will help make you a competitive applicant for the grad school that you're applying to. So this is just a list of the ACE Center resources. We have something for almost every stage of the process, especially students who are still exploring. That includes major exploration advising, academic planning, experiences, and application prep. So you don't need to use all of this at once. It's just so you know it exists when you're ready. So what are the common academic elements to pre-health? So there are a few similarities in prerequisites like biology and chemistry amongst most health professions, but exact requirements vary by school and profession. So that's why flexibility is really early on is really important, especially if you're undecided. Planning smart early will help keep options open later. I would also like to note that most professional schools will require 2 semesters of English and a semester of math. Some schools might even require calculus. So that's just something to keep in mind. You'd always want to look at the program and their official prerequisite list to make sure that you're able to get everything done within the 4 years that you are an undergrad. Or even if you would like to take a gap year or two after as well. So these are just the common prerequisites. There are more out there just depending on the program. So this is just a slide about how to prepare yourself academically. If you're undecided, a great first step is by taking the My Major assessment. It's on our website and there's a QR code for our website on the slide, and it takes around 15 minutes. And it kind of, after you take the assessment, it kind of lists out majors that suit your interests and passion and what you want to do later on in life. And most of these majors can be planned in a way that helps keep pre-health options open. So I'd recommend keeping your options open and taking advantage of every opportunity that you have. So if you have any questions regarding the My Majors assessment, or you'd like to go over it after you take it, we are also happy to help you do that as well. Experiences that make you competitive. So experiences at the end of the day are really about just learning what you enjoy. That might be volunteering, shadowing, clinical, or research. And you don't need to do everything at once. Start with something you're curious about. Over time, that curiosity will turn into clarity, and try to indulge in experiences that you really are passionate about instead of just doing things for the resume. You could even start by joining a club. It could be a pottery club. It doesn't even have to be related to pre-health. It could just be something you are really, that's something that you really like. So at the end of the day, it's very important to remember that you come first, because pre-health can feel a little intense at sometimes. And what the best way to do that is by making sure that you have balance and support. Advising, community, mental health, and rest are all part of being successful. So again, just remember that you come first. So right here is our Health Professions Expo, and it's coming up, and I'm really excited to announce that it'll be taking place February 18th from 12 to 3 p.m. And this is especially important to go and kind of just walk around and see what are the options out there. You can walk around, you can listen, you can ask questions. There's no pressure to know exactly what you want. It's meant to help you explore. And I go here every year I've been at university. I've been to this exploration event, and it's been one of the best things because I always see something new there every year in terms of the people coming in and the people talking about the different programs and opportunities. And even if you have a few minutes in between classes, I would definitely recommend that you take that time to just walk in for a few minutes and see what's there. So right here are some of the commonly asked questions by students, and I'll go over them one by one and help answer them in case you have the same question. So how often should I meet with a pre-health advisor? I would recommend that you meet with a pre-health advisor at least once or twice a semester, just to make sure you're on track and you're able to get any advice or anything to guide you in the right track. Another thing is, what GPA do I need to have to be competitive? And I would recommend that you keep your GPA as high as possible, specifically higher than probably a 3.5, only because a lot of these professional schools are really competitive. And most professional schools have a holistic view of your application. So GPA is not the only thing that they will look at, but it is a core component of your application. And then, can I use AP or IB credits for prerequisites? And the answer is yes, but also it just depends on which school you're applying to. Some schools will accept it while some schools will not. So it's very important to look at the program specifically. In terms of how do I know which health profession is the right fit for me, and that all comes down to what your interests are and what your passion is. And this you can kind of figure this out through your experiences and through your involvement in different activities, as well as how you like your classes that you're taking as an undergrad. And do I need to get involved in a lot of clubs or just focus on one? Honestly, if you could just focus on one or two and really grow in those clubs and make an impact, that looks way better than you spreading yourself out wide between a lot of clubs, because you want to make sure that you're able to grow from those experiences. So here are the next steps, and they don't have to be big. You can just start by exploring resources, reflect on interests, and asking questions. Meeting with advisors or even coming to drop-in sessions can really help make things feel more clear over time. So as for our drop-in sessions, we have drop-ins every week, and they're a really easy way to talk things through. So you can come in with a specific question or literally just say, I'm not sure where to start, and that's okay too. And the times for these sessions are listed on the flyer on the slide, and the QR code will take you to our website where we have it listed there as well. So here are your official and professional advisors that you can meet with, and some advise both like pre-health and pre-law. So if you're exploring multiple paths, that's completely fine as well, and they'll really help and kind of guide you in the right direction. So before we end the session, I do just want to mention that I really want you to just remember you're not behind and you don't need to have everything figured out. And exploring is just part of the process. And we're here to support you whenever you need it. So if you guys have any questions, please feel free to reach out to me or any one of the peer advisors, and we're happy to help. That's what we're here for. So before we end again, I just want to share my screen and show you guys the A Center website so you're able to kind of navigate through that as well and use it as a resource. So this is our website right here. And if you scroll down, there's the My Majors assessment if you'd like to take it, and there's the pre-health the Health Professions Expo right here if you'd like to just see any more information regarding that. And there's the different little tabs here. So there's major exploration, pre-health, and pre-law. If you click on pre-health, this is our pre-health tab. So if you scroll down, you can join our listserv. We send a lot of opportunities and things that could really benefit your experience or help you take the right path through just like the listserv, so we can send you information. Here are our advisors. You can make appointments with them here, as well as we have any important events coming up on that tab. And here are the different types of just like pre-professions that you could be interested in or you'd like to take a look at. So once you click on a certain one, right here, pre-dentistry, for example, you can join the listserv again, and we'll send out opportunities specific to dentistry. And here are the common prerequisites listed here. And just so you know, these are common, so they might differ on the program or school you're applying to. And then if you scroll all the way down, there's important resource websites for you that you can access that'll help you get more information on the specific specific profession that you're interested in. As well as if you scroll down here, there's a lot of different opportunities that we have listed that you could get involved in just to help you explore pre-health. So there's a bunch of clubs listed here and volunteer opportunities, as well as we have our research experience and clinical experience opportunities there. And here are all your pre-health peer advisors, as well as your ambassadors. So feel free to just kind of go through here and see if you want to reach out to someone. We also have like a little description of what we do and what we're involved in, as well as our majors and minors. So if you're interested in something that, like for instance, right here, Alexandria is involved in extracurriculars such as the American Student Dental Association. And if you're interested in dental school or anything, just feel free to reach out to her and she'll help you just figure out your way as well. So we're all here as a resource, and please make use of us as well. So that's it for our pre-health session. And if you have any other questions, again, please feel free to reach out. But thank you so much and have a good day.